During Western blotting, there are lots of steps in the protocol that can affect your results. There are several common issues that we see during imaging of Western blots and some troubleshooting we can do to improve the results. The first issue is not seeing any signal or seeing a very weak signal. There are three main reasons for not seeing visible bands on your membrane: poor protein transfer, problems relating to the primary or secondary antibody, or problems with the detection agent. To confirm protein transfer, stain your membrane with a total protein stain, such as LICOR's Revert total protein stain. For more information, refer to the Transferring the Proteins Lambda U course. If the transfer was successful, check that the antibodies and ECL reagents were stored correctly and used at the right concentrations. Also, check the storage conditions of the blots after transfer and that the secondary antibody is the proper species to ensure that it will bind to the primary. When the bands are visible but appear weak, the issue could be low protein loading in the gel, poor transfer, too little or inactive antibody, short exposure times, or a substrate that is not robust enough. Remember that an antibody raised against a native protein might not bind the denatured form of your target protein. Further, make sure the secondary antibody is directed against the species in which the primary antibody was raised. Verify the concentration of your antibodies using, for example, a dot blot, and strip and reprobe the membrane if necessary. Another issue is having excessive or saturated signals. Excessive amounts of protein or high concentrations of antibodies, along with excessive exposure times or wrong sensitivity substrate, can lead to saturated signals. These signals are no longer proportional to protein concentration and may therefore not be used for quantitation of the target protein. The high diffuse signal intensity also makes it difficult to resolve protein bands that are very close together. Reduce the concentration of the antibodies and confirm you are working within the linear range of your target to help avoid diffuse signals. Sometimes you may see the presence of brown or yellow bands on the membrane. These are often termed burned bands. Too high a concentration of antibody can not only cause high background, but can also use up all of the substrate added to the membrane before it can be detected. This can result in no or weak signal. Ensure to optimize both primary and secondary antibody concentrations. You may see the presence of what we call donut bands. Occasionally, when imaging a membrane with chemiluminescence, white or negative bands can appear alongside the normal black bands. These are the result of substrate depletion, and it becomes difficult to quantitate the band in question. Substrate depletion occurs when too much of the enzyme horseradish peroxidase, HRP, is present in a band, quickly consuming most of the substrate. Reducing either the target protein or the antibody concentration should help prevent these white donut bands, in addition to increasing the amount of substrate added to the membrane for detection. You may observe spotted or high backgrounds. This can be caused by problems with the blocking agent, antibody, or contaminated equipment. This might result from insufficient blocking or low concentration of the blocking agent. Make sure you are blocking for 1 hour with the membrane completely submerged in blocking buffer so that it doesn't dry out. You can also try increasing the blocking agent concentration. Ensure that the blocking agent is dissolved in the buffer by gently warming and mixing to avoid aggregates. Concentrations of antibodies and detergent in the washing buffer are also potential causes of high background. Try reducing the concentrations of the antibodies or the detergent. Also ensure that the blocking and washing buffers are freshly prepared and that you use fresh antibody dilutions for every Western blot. Ensure the membrane remains wet for the entire protocol and does not dry out. Contamination can happen and will result in very high background. Make sure you are using clean transfer and incubation buffers, as well as using fresh antibody for every experiment. Ensure you're spending all of the necessary time on washes, as insufficient washing is a frequent source of background staining in antibody-based detection. Always keep surfaces in contact with the membrane clean. Wiping the surface of the imager with 70% ethanol, followed by deionized water, is a good practice. The golden rules are to handle the membrane with care and with clean forceps, as well as to use fresh reagents during the entire protocol to ensure there is no contamination. A fifth issue that is frequently observed during Western blotting is the presence of multiple bands on the membrane rather than a single band. There can be several reasons for this. First, the primary antibody may not be specific for only your target of interest under your specific assay conditions. Make sure to validate any antibody for specificity prior to using it in your Western blot protocol. Another reason you may be seeing multiple bands is that the primary antibody concentration is too high. Try decreasing the concentration of the primary antibody to alleviate these issues. Run a secondary antibody control only without the primary present to see if the secondary antibody is binding to the membrane and causing these nonspecific bands. Another thing to check is if the antibody was purified and how. Try to use an affinity purified antibody. This will often help remove nonspecific bands. Another way to try to reduce nonspecific bands is to test several different blocking reagents. Depending on the protein target, some blocking agents will do a better job at preventing nonspecific binding of the antibodies. In this lesson, we have talked about the important steps involved in the detection of your chemiluminescent Western blots. Examples include making sure to choose the appropriate substrate based on whether you will use X-ray film or a digital imager in order to measure the signal, choosing the appropriate substrate sensitivity based on the abundance of your protein target, and troubleshooting your blot if you have issues with things like high background, nonspecific bands, and other issues we discussed. Now Carol will expand further on some of the best practices involved in chemiluminescent Western blot detection.